Get started. Welcome to Batesville Rotary Club. You'll stand, and Jared, if you please lead us in the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Max, would you lead us in prayer?
Let us pray. Our Father in heaven, we thank you for all the blessings you bring to us. We especially thank you for this season. We have so many things to be thankful for, and yet so many people are suffering at this time. Be with us as we travel to and from our locations for Christmas. Be with those families that are in pain. Guide and direct us and keep us safe. We will not fail you with praise. Amen.
Amen. I don't see Nelson, so I'll lead you in the first verse of Rotary.
I thought you were going to sing Jingle Bells.
Do you want to? Johnny's going to lead us in
Dashing through the snow in a one-horse open sleigh, o'er the fields we go, laughing all the way. Bells on bobtails ring, making spirits bright. What fun it is to ride and sing a sleighing song tonight. Oh, jingle bells, jingle all the way. Oh, what fun it is to ride in a one-horse open sleigh. Hey, jingle bells, jingle all the way. Oh, what fun it is to ride in a one-horse open sleigh.
Oh, it's good. I could have been beat up.
We have a few housekeeping matters. We have proposed at our last meeting, after the board's vote, Dennis's board. We need to have that approved by this club before the end of the year. I'll repeat the names again. The president will be Dennis Moore. President-elect will be Donna Cole. Past president will be me. Treasurer will be Alicia Faust. Secretary will be Amanda. Sergeant-at-Arms is Ron. Matt McDonald will continue as administration chair. Matt Martin will continue as the foundation chair. Ryan Puckett will continue as the membership chair. Kathy Drew will continue in the publicity chair. Deanna Green will continue as the service chair. And we'll have Jared, Wayne, Aaron, and Cassandra serving as board members. So you've had a chance to think about that. If anyone else has any objections, now's the time to say so. Otherwise, I would entertain a motion to approve the board.
So moved.
Second?
Second.
Thank you. All in favor?
Aye.
Opposed? Good.
Nobody volunteered.
We complied with our bylaws. Thanks for everybody who came to the Christmas party. I think we had a great time, especially since I wasn't there to lead it. So I'm sorry I had to miss the event. I appreciate Dennis doing that for us. Beverly Parker did a great job from what I hear. I appreciate Aaron coming in and videoing everything that went on. We passed around the Christmas cards. Everyone had a chance to sign the Christmas card for our 5 honorary Rotarians who don't attend with us. If you haven't had a chance, we are going to send them all Christmas cards. One of our honorary Rotarians is Peppy Grace, and of course his wife Nancy passed away last week, so we join him in mourning her passing. No meeting for the next 2 weeks, so don't come to Rotary next Monday or the Monday after that. You'll be alone. We'll come back on January 8th. Yesterday was Jared Cook's birthday, so let's say happy birthday to Jared.
Happy birthday, Jared.
And Alicia has a wedding anniversary in 2 days, or maybe a day. Tomorrow, so it's within a day. So we hope you have a happy wedding anniversary. The Rotary Club is continuing to push forward. We have 19 students interested in that at Lyon. That's a great thing. We've all worked hard on that, and it just sort of happens. We have students that are interested in joining. The dictionaries. I have still a number of dictionaries at my office. If you have not picked up your dictionaries yet, please call the schools. If you need to know who you are, and if you don't know which school you're assigned to, but you know you signed up, please get with me. I have a list. But let's try and distribute those before the schools go out of session. I think they're going to go out this week, so it may already be too late. But there are a number of dictionaries still in my office. Scholarships, I think we're going to keep our scholarship application period open until February 1 or maybe the middle of February, so please continue to publicize that with our area high schools. On February 15th of 2018 will be the District Foundation Banquet. That'll be at the Clinton Presidential Library. We will have a table or maybe two. So if you're interested in going, please let us know and we'll make sure you get on the list. In March of next year, we'll have the trap shoot tournament, and March 17, right, Amanda? So also be thinking about that. And we are currently exploring hosting a district bike ride. The district has approached us about doing a bike ride. They're going to do a fundraiser, and they'll bring a lot of the support and help. But the board voted today to move forward with exploring that and talking to the city. So that would happen in May of next year, and it would be a district event in Batesville. Any other announcements for the good of the club or community before we get to chair reports? All right, Ron Carter.
Question for Mr. Kent over there. How many horses pulled the sleigh in Jingle Bells?
What did you say?
How many horses pulled the sleigh in Jingle Bells?
It's a one-horse open sleigh, so.
That was my trivia question tonight. If you're standing up in front of 400 people,
Yeah.
it's not easy to sing that through.
It's like
Rotary
a plane
friends.
crashing and everybody died. How many survivors were there?
We have a pair today.
Yes.
Mr. Cole
Yes, sir.
and Barrett. Which one wants to go first for Rotary Friends?
I'll go first.
All right,
All
go.
right, great.
Barrett and I did have lunch recently. I've known Barrett for a long time. I've known his father, Malcolm, for, I've known his grandfather, Malcolm, for a long time. I've known Shelby for a long time, his father. Barrett's been a member of Rotary for 6 years. He's married to Sarah, 5.5 years. No children, but they're planned in the future sometime. They have one dog, a graduate of Hendricks and UALR in Little Rock. That's all he said I could say.
That's a lot.
I feel like I've known Dale all my life because he moved here in 1988 and I was born in 1984, so I guess I have known him all my life, practically speaking. Anything else, Ron?
That'll do it.
Okay.
Now, Barrett, the way Dale presented that, he said you had one dog, and it sounded like he was a graduate of UALR.
He's a very smart dog. He has a law degree. Amanda, Secretary's report.
Yes, not a whole lot going on right now. I will get the new board entered into DAC-DB as we approved it, effective June the 1st. And Steve has a kind of sort of guest with him today.
As the school's out, my wife Ellen is here, and I want you to know that she's mad because she's off for 3 Mondays, and this is the only Monday we have Rotary. So it's only natural
What
to go
can you
down.
say?
Well, welcome.
Welcome, Ellen.
That's all I
Ryan, I think you have some guests with you too.
have. Sorry.
Colby's visited with us several times. So it's my son Colby. He's a 5th grader at West. And this is my daughter Brooklyn. And she is a kindergartner at West.
Okay.
Not
So,
supposed to take the phone away from that.
Yeah.
Colby and Brooklyn.
And I was
Yes.
noticing both of them were doing a great job singing, which I don't think would have happened if we'd sung the first verse of
No,
West.
Colby
Right.
could
I know, I
lead.
know.
Colby could lead you.
Colby's like me, we come with.
Yeah, Colby could lead us in the first verse of Rotary. Brooklyn wouldn't have to.
They're in
play.
that kind of sort of guest category.
Dwight's not here, but we did approve the financials, or we talked about the financials at the last meeting. The club's doing fine financially, and we're moving forward. We have enough money to fund our scholarships, and we're looking forward to raising money next year. I think invoices will go out again soon, maybe in January or something like that. So just keep your eye out for that. Service projects, I don't think we have anything else for the month, so I hope everyone has a Merry Christmas. Max did a great job as a door greeter. He was here early. I thought he was going to join the board for a minute, so give Max a hand. And I'll be your door greeter next time. There's no other announcements. I'll invite Amanda to come up and introduce our speaker.
I'm very honored today to present this guest, as she's been one of my best friends since 1994. When her parents moved back to Batesville, her father's from the Batesville area, and he had retired from the military, and they moved here from Japan. And I got the privilege of meeting her as part of her welcoming committee to the area, and we've just been stuck like glue ever since. So, love her. April is a current employee of the Bridgeway Hospital. She is a Senior Care Mobile Assessment Coordinator for the Bridgeway Senior Care Unit and has 9 years of clinical experience. Born into a military family, she is no stranger to meeting or forming relationships with diverse populations and communities. She understands the need for mental health care across all age groups and enjoys traveling around the state, bringing awareness to communities about the excellent care Bridgeway provides for seniors as well as for all other ages. So if you don't care, welcome my friend April.
Well, thank you so much, Amanda, for introducing me. Like she said, we have been stuck like glue for quite some time, so it's a wonderful honor to call her my friend. Kind of feel jealous because y'all get to see her way more often than me. But that's kind of my fault since I live far away. So, like she said, I'm the Senior Care Mobile Assessor for the Bridgeway Hospital, which is in North Little Rock. And what I do every day is I go around the state just kind of getting the word out about the Bridgeway Hospital. And as a mobile assessor, whenever somebody from, for example, a hospital or a mental care facility or even a medical clinic calls me and says, we have a psychiatric emergency, we have this person, maybe they're psychotic or needing some sort of mental health care on an acute inpatient stay, what I'll do is go out and assess that person, and then I call my doctor and try to get them into the hospital. So I do a little bit of marketing as well as mobile assessing. And so it's really nice to be here and kind of get the word out to you guys. Are there any medical professionals in this? Nobody? Okay. Oh, 2 people in the back. I see you now. Okay. All right. So maybe this will pertain a little bit to you, but for anybody else, if you don't mind to just listen to me, and if ever you come across somebody who's maybe in need of mental health care, feel free to mention the Bridgeway. So what I thought I'd do is just bring it's the Healthcare Journal, and we have our CEO, Mr. Jason Miller, the CEO of the Bridgeway Hospital, who writes for this particular journal. So every so often he'll write an article, and I just wanted to read it to you because I feel like it pertains to everybody in some way, form, or fashion. So, all right. It says, over the past several issues of this journal, I've described the complicated nature of mental health and substance abuse. I've told the complicated stories of those suffering from addictions and the need for treatment for those conditions. I've explained the complications of treating suicide and the ongoing need to recognize the signs of depression and suicide, especially with our children. I described the complicated nature of mental health for seniors and their desire to simply live out their remaining days as comfortably as they've lived those before. And as I painted the complicated picture of access to mental health across the spectrum and implored all of us to speak up, advocate, and listen. So it is clear that mental health is complicated because people are, well, complicated. But how is something we know so much about really so complicated? We know the statistics. Someone in Arkansas commits suicide every 15 hours, and suicide is the second leading cause of death for those ages 10 to 34. We know many of the symptoms that impact lives: sadness, hallucinations, overuse of alcohol or drugs, feeling hopeless. We know some of the best treatments that work: therapy, medications, hospitalization, intensive outpatient programming. And we know the outcomes when mental health is left untreated: suicide, disability, loss, grief, homicidal actions, or even death. We know so much, right? Well, the answer is yes. We are, with mental illness, battling something very different: the complicated nature of the entire human experience. Mental health issues are rooted deep in the soul of healthcare. Patients experience symptoms that are very evident while simultaneously dealing with those well below the surface. Patients are faced not just with the symptoms we can see and treat, but also with those they cannot explain. Mental health issues often lie right on top of physical conditions. Just ask someone with cancer if they struggled to remain positive and focused after such a diagnosis. Psychosocial factors like family issues, financial pressures, legal problems, school, and weak support systems are not just everyday things for someone who is depressed. They are often the direct link to symptoms and outcomes of the illness. Something as simple as balancing a checkbook, making dinner, taking a test, or socializing with others can become unbearable. Not because they are difficult, but because those stressors are a direct part of the problem. The intangible makes mental health disorders so much more complicated, but arguably the easiest to impact. What if we supported our families and friends suffering from depression or alcohol or bipolar disorder, rather than pushing them away because they've burned their bridge with us? What if we invested in suicide screenings, awareness, or conversations like we do for other serious issues like smoking or cancer or heart disease? What if we listened to each other rather than worrying about who or what is in social media? What if we had conversations about depression or isolation or bullying or their impact on violence rather than conversations about the NRA? What if we realized the impact to another's feelings when we lack the tolerance to coexist with those who might be different from us? What if we realized the serious emotional strain of someone who cannot find a job, rather than blaming them or accusing them of being lazy or unwilling? What if we thought first about how to properly co-parent our children during a divorce, rather than impacting them negatively because of our anger with our ex-spouse? What if we worried about what our children learn from us when we talk down to another person or condone negative remarks from those in leadership or influential positions? What if we expressed empathy for someone addicted to alcohol or drugs, rather than judging them for their earlier choices in life? What if we helped the mentally ill who are homeless, rather than shaking our head at them as if they made the choice to live on the streets? What if we paused to remember our own stressors in school, from friends to tests to sports to relationships, rather than assume our children are really that much different from us at the same age? What if we understood that life is complicated, that people are complicated, and that we can positively impact the lives of those around us by understanding a little more, listening a little more, helping a little more, leading a little more, and giving a little more? The solution to better mental health, to lower suicide rates, to lower prevalence of depression, to decreased use of drugs and alcohol, and to better access to treatments rests with the understanding of the entire human experience. It rests with all of us recognizing the intangible nature of mental health, that everything we do every day has a direct impact on the illnesses that lead to disability or even suicide. So let's ask ourselves, is it really that complicated? My best to you. So, I thought that was a really amazing article. It really makes you think about human life and what we can do to make everything better. So, thank you guys again for having me. And if you have any questions about the Bridgeway or just mental health in general, feel free to come and ask me afterwards.
April, tell us a little bit about what you actually do.
What I do
in your role.
In my role, well, like I said, I assess a person. So if somebody were to call and tell me that they had a psychiatric emergency, I would actually go and provide an assessment, which, by the way, are free of charge. And I would just assess that person and kind of find out, are they a good candidate for mental health care in our inpatient facility? And if they weren't, I would definitely provide the resources that someone would need to get them into a facility, into care of some sort to help them. So that's what I do. And when I'm not assessing somebody, I just kind of go around the state and market our program. And as the senior care mobile assessor, I'm actually over the senior care unit, which is a unit specifically for patients aged 55 and above. So we have at the Bridgeway 6 units. We had Unit 1 and Unit 5 are adult care units for anybody 18 to 55 with any kind of serious inpatient needs. Unit 2 is our drug and alcohol detox program. So it's a short-term detox, usually 5 to 10 days. And then Units 3 and 4 are our child and adolescent units. Unit 3 is child and adolescents, and then Unit 4 is our long-term adolescence unit. And then 6 is our senior care unit. So.
Do the calls, do they have to come from a medical provider to you, or can families call?
Not necessarily. Families can call, even the person who's needing services can call. So it's really fair game for anybody. So even a teacher can call. A lot of times we have teachers or like a school principal call. They don't call me necessarily because I'm over senior care, but they'll call our other mobile assessor. Her name's Kim Rand. And then our assessor for this area is actually Natalie Bland. And so there's 3 of us that do mobile assessing for the Bridgeway.
What are the most common conditions that you come across for people that come to the hospital?
Oh, goodness. For me in particular, because I deal mostly with senior care, would just be, sometimes we get patients that have Alzheimer's or dementia, and so the behaviors that go along with it, while we don't treat Alzheimer's and dementia, we treat the behaviors that go with it. So a lot of times people are very confused, they become combative, aggressive, they might become very paranoid, and start to have hallucinations, for example. So we kind of treat those behaviors and kind of get them stabilized to where they can go back to where they came from, whether it be an assisted living facility, a nursing home, or home. But across the board for any unit, we get a lot of suicidality, homicidal thoughts. Like I said, aggression is typically one. If it's not normal to their everyday living. So basically, we're just looking for anybody that's a threat of harm to themselves or others. We want to definitely get them stabilized.
Do you help people that are homeless if somebody gets a hold of them and needs to send them somewhere?
Well, what we do, we work very closely with the community mental health centers, and so if the community mental health center had somebody that were homeless, they have the grants that would pay for somebody who's indigent to come into the hospital, and they would pay for a certain amount of days out of the grant money. So we definitely work with the community mental health centers to get them the care they need. So
We found one this last week that's been homeless in Batesville for 2 years, living under one of the bridges. A guy named Jason Ramsey found him. Couldn't even talk. Adult, don't know his age, probably 50 plus or so. Only weighed 75 pounds. Got him into White River Medical Center, and so they saved the man's life. And so now we're trying to find a home for him right now, but been homeless for 2 years, living under a bridge here in Batesville. And we've got to get the city of Batesville to do something about this.
any other questions?
Do you take voluntary commitments, or are these people who you also take involuntary commitments?
We do both.
Okay.
Voluntary and involuntary. So we'll work with the family. So, for example, a patient is adamant that they're not going to sign themselves in. Sometimes if they're coming through the ER, we can do like a 72-hour hold where the doctor will say you have to go, and they read them their rights. Other times we'll encourage a family member or police officers, somebody to go and actually speak with the prosecuting attorney and get them to do an involuntary commitment. where then they, would have to go to court and the judge would say, you have to go, and this is how long I want you to be there. So we do it either way, voluntary, involuntary, so.
I assume most of the people though are, their parents are bringing them in, or their guardian, or they're just voluntarily coming in
Yes.
to need help.
Yep.
What's the size of your facility?
Say it again?
The size, how many, which capacity, I guess?
I think it's 136 beds altogether. I could be off, give or take a few, but our senior care unit is a 20-bed unit, and so then each unit from there is 20 to 30 beds. So, yeah, it's a really nice campus as well. It's up in the woods, so everywhere that you look out of a window, you just see woods, and it's really beautiful and quite serene. So,
What's the average length of stay?
For most of the units, the average length of stay is usually 7 to 10 days. Sometimes more, sometimes less, just kind of depending on insurance as well as the patient needs. And then our long-term adolescent unit, it can be anywhere from a month to 6 months, just kind of depending on their needs. So.
Do most insurance pay for that?
Yes, and we do accept all insurances, Medicare, Medicaid. The only thing that we don't accept, just because of a med-surg law that says we can't accept Medicaid past age 20, they have to go to somewhere like UAMS or Baptist or one of the bigger hospitals. So, but TRICARE, VA, you name it, we cover it. So.
I bet you're full right now.
Are we full? No, we always have some bed availability, so it just kind of depends on the unit as well as the doctor, if they're capped or not. So I can say that the senior care unit, we've never reached capacity, which is a good and a bad thing for us. So, but usually the unit that stays the fullest, unfortunately to say, is the child and adolescent unit. So, and then the next unit would be units 1 and 5, the adult units. So, but generally speaking, we have bed availability, so, which is good, especially working with Batesville and like the stepping stones and then their long-term care facility, because, a lot of times they're full, and so we'll take their overflow. Anything else? Well, you guys have been wonderful. Thank you so much, and if you think of anything, I'll be around for a little while, so.
Thank you, Ed. And we are doing a literacy project, and so we'll donate a book to the local library in your honor for speaking to us today, April. We know you drove a long way to be here. And if you would pick our winning Joker draw ticket as well.
Okay. 231-7974. 7974.
I know who has that. He's right ahead of me.
Yeah. I'm glad that you waited.
And he said if he got the Joker, he was gonna split it with him.
That's between you two. I don't have anything to do with what
But he
happened.
did offer me the opportunity to go ahead of him. He was a gentleman.
Y'all can find it out later.
You might split the joker, but not the pot.
Yeah, exactly.
You'll be
You
glad to
three.
Nine,
glad to know
one
it's
off.
safe.
Yeah.
Oh, man.
We're getting closer.
Good.
Getting closer, closer.
Wait a minute, there's not a Joker in there.
Yes, there is.
There is. We verified the Joker.
Right there it is.
Yeah.
Now, don't reshuffle.
No Rotary for the next 2 Mondays. Don't show up. Come back on January 8th. I think we'll hear from Mike maybe then about the Batesville School District. No other announcements for good of the club or community. We'll end with a 4-way test. Number 1, is it the truth? Number 2, is it fair to all concerned? Number 3, will it build goodwill and better friendships? And number 4, will it be beneficial to all concerned? Merry Christmas.
Merry Christmas.